Mr. Speaker, the COVID-19 crisis has confirmed how vital it is to have a strong economy that can continue to guarantee the delivery of essential services. In this budget, there is record funding for hospitals, record funding for schools, record funding for aged care, record funding for childcare and record funding for disability services. We're providing an additional $3.9 billion for the NDIS, which is providing life-changing support to 400,000 Australians with a disability. Every Australian can be confident that the NDIS will always be fully funded under a coalition government. We have committed over $16 billion as part of the government's ongoing health response to the COVID-19 crisis, securing millions of masks, gowns, goggles, ventilators, and we have worked with the states to significantly increase the capacity of intensive care units right across the country. We have extended Medicare subsidised telehealth services, enabling more than 30 million consultations to occur since the crisis began. And we've secured access to more than 80 million doses of potential vaccines for COVID-19. Mr. Speaker, mental health and suicide prevention is a national priority. My heart goes out to all those Australians, young and old, for whom COVID-19 has caused such pain. My message tonight is that this House stands with you. You are not alone. Around 7 million Medicare subsidised mental health services have been delivered since March. And tonight, we are doubling the number of Medicare-funded psychological services through the Better Access Initiative from 10 to 20. We're providing more funding for Lifeline, for Headspace, for Beyond Blue and for Kids Helpline. We're providing support for more young Australians with a mental illness to help them participate in the workforce. And these initiatives will bring our commitment to mental health to $5.7 billion this year. And this is not the last word. In coming weeks, we will release the Productivity Commission's Mental Health Final Report and the interim report into suicide prevention that was commissioned by the Prime Minister. These reports will guide our future actions, and working together with the states and the territories, we will save lives. Mr. Speaker, the Pharmaceutical Benefits Scheme has provided critical medicines to Australians. We have delivered on our commitment to list all medicines recommended by the independent experts, with more than 2,000 new and amended listings since we came to government. Tonight, I'm announcing the listing of Lynparza to help women with ovarian cancer. Instead of costing more than $140,000 per course of treatment, patients will now have access to this medicine for $6.60 per script for concession card holders and around $41 per script for general patients. This is what it means to have a strong economy. This is what it means to look after one's fellow Australian.